Welcome to the Metro-North Chamber of Commerce Taking Care of Business. My name is Tom Snell. I'm the director of the Chamber, and you can see our program every Tuesday, Wednesday, and Thursday evenings at 7 p.m. And I'm really pleased to have with us today our guest, Craig Westover. And Craig is from the Free Market Institute. And Craig, before we get into our discussion, which will be on healthcare related issues, I'd like you to tell me just a little bit about the Free Market Institute and what you folks do.
Sure, Tom. The Minnesota Free Market Institute, we're a nonpartisan 501c3 corporation, and basically we're a center-right think tank that tries to educate and inform people about the free market on one hand. So we're trying to tell people about what the benefits are of the free market, how it works, so that people have an understanding of what it really is, and then also to take information and develop free market policies that address kind of the bread and butter issues that people are talking about today, healthcare being one of those issues, which we're going to talk about today. So that in a nutshell is kind of what we're all about and what we do.
Okay. Well, you know, again, we're going to be talking about the healthcare issue because it is probably the defining political issue when we look at it from both a business perspective and an individual perspective. And right now, we're looking at close to 50 million people joining the ranks of the uninsured, and business premiums going up double, sometimes triple the rate of inflation. So it is getting to that critical mass issue, and that's why perhaps the president now has it as one of his defining issues. It's been said by some that the free market healthcare system isn't working, that it's broken, and if you look at other countries around the world, the other free, what we would call our free countries that are on our border, Canada, Western Europe, they rely more on a healthcare system that is government-based, whereas our system, people say, or some political pundits say, is free market-based. And I'd like you to answer that, if you could, in a broad context. Do we have a free market-based system, and
Sure.
and just a slight comparison?
Sure. The answer to the major question you asked is, do we have a free market system? And the answer is no. And so let me quickly try and define what a free market system is and contrast it with what we have now. First, now what we have is we have a managed care system. We don't have a free market system. In other words, you have a system where you have a third party that basically tries to manage the system rather than letting individuals make choices about their health care. In a free market system, there's three characteristics that really have to be met. The first one is that the patient has control of the healthcare dollars. Now, those dollars can be their personal money. Those dollars can be money they get from an insurance company. It can even be dollars that they get through a government program. But they control the dollars. They decide what doctor they're going to see, what services they're going to buy, and they have control over how much they're going to pay, in the sense that they can make a decision between one doctor and another, one service or another. The second criteria of a free market system is that the doctor controls what services he or she is going to deliver and what those services are going to cost. The doctor is influenced in making those decisions, obviously, by patients, because if they're charging too much, if they're not providing value, patients are not going to go to those doctors. The third criteria of a free market healthcare system is that insurance companies decide what's going to be in their policies and what they're going to charge for those policies. Again, they have to create policies that meet the needs of the consumer. And understand, when we talk about insurance in that context, we're not talking about prepaid health care like we have now. Today, you pay a premium, but then when you go to the doctor, from $1, less a copay, the insurance company is paying. The insurance company pays for your visit. The insurance company pays for your test. What real insurance is, it's manages your risk. Insurance, like your car insurance or your home insurance, is to protect you from unpredictable and unaffordable expenses. You pay a certain premium each month. You pay for your maintenance costs on your car. You pay for maintenance costs on your home. But if something dramatic and drastic happens, the insurance company picks it up. So that's what a free market healthcare system is. Now, as a comparison to systems around the world that are more government-oriented, those are also managed care systems. The difference between a lot of those systems and our system is that in our system we have public companies that are heavily regulated that are managing the healthcare plans, whereas those countries have governments that are managing the healthcare plans. The process and everything is the same. The argument is that with a single payer you have lower administrative costs. You can argue that on the basis of, yes, you have lower administrative costs, but a lot of the administrative costs in a single-payer government-run plan are being passed back to the doctors who are doing a lot of the paperwork. So whether or not that is a valid criticism, I don't know. But the key issue is that in any kind of a managed care system, whether it's managed by the government or by the private or by a private company, somebody else is making your healthcare decisions for you or is severely restricting the parameters of your healthcare decision. In a free market system, you and your doctor are making those healthcare decisions.
Okay, then I would assume, after what you've told me, that you don't think that people should be forced or required to purchase health care if they don't want to. Would that be correct?
Yeah, I don't think that people should be able, from a moral standpoint, I don't think they should be forced to buy health care. But by the same standard, I don't think then that there's an obligation on the part of the state to pick up their health care costs, because they don't. There's a responsibility there for people to make their own decisions.
Because I mean, one of the issues that drives the high cost of health care, and why some people say that we should have the requirement that people have coverage, is because typically the people that don't purchase health care are the people that are the youngest people in the system. The 22-year-old guy, male, that doesn't think anything is going to happen to him, that he can drive through a brick wall and be unscathed.
But this is here's the problem. You're exactly right. But here's the problem, and this is where government intervention and management of the healthcare system starts to screw us up. If I'm a healthy 25-year-old male, in our current system, you're asking me to bear the burdens of price for all the older people or all the sick people who are in the system. And this is what the problem is that we have so many mandates on the insurance that we don't have a policy that 25-year-old can afford that really meets his needs.
But if we did, couldn't we be faced with a problem that people that are maybe between the 50 and the 62-year-old group, people that have what are called pre-existing conditions, which are individuals that have had some health concern and have a difficult time purchasing coverage, or at least coverage that would be construed as affordable? Won't they have more problems in doing that if unless we have younger people brought into the system to lower their costs, and if they can't purchase coverage, then doesn't that just lead to more problems down the road? What you're talking about,
The scenario you just described, the answer is absolutely right in the kind of system we have now. But let's look how that problem might be solved in a free market system. And again, asking what the free market system might do to solve a problem is kind of like asking what product is going to replace the iPhone. In a free market system, the beauty of it, and understand is just by way of background, the beauty of a free market system is people who are a lot smarter than you and I are going to be figuring this stuff out and have the wherewithal to implement what they figure out if you take government out of the equation. But having said that, let me explain one free market scenario for pre-existing conditions.
Okay, I'd like to hear that.
Okay, here's this. Some companies are already developing this on a smaller scale, and it's called health status insurance. And let me try and explain simply how that works. Take your healthy 25-year-old male. Right? A healthy 25-year-old male, on average, when you look at accruals, at accrual accounting, the way that insurance companies work, spends about $2,000 a year on health care a year. Now, some people spend a whole lot less. I've never spent $2,000 in my life on health care, and I'm 50 years old. But others will spend a lot more. But on average, accrual, if an insurance company is going to make money, they're going to charge a healthy 25-year-old male for an insurance policy about $2,000 plus their administrative costs plus their profit.
Okay.
Okay, so that's the policy that any 25-year-old male should be able to buy. What health status insurance is that same 25-year-old male would purchase an additional policy. Now, let me back up.
Okay.
That same 25-year-old who's going to spend $2,000 a year on average for health care has about a 1% chance of developing some kind of chronic condition that would cost $10,000 a year to treat. Again, that's average. Some people spend a lot less. Some people develop chronic conditions that cost a whole lot more. But on average, so he would have, for an insurance company to cover him for his chronic condition, they would have to charge him a premium of $10,000 a year plus administrative costs plus their profit. $8,000 a year more than he's paying. Now, if you look at the combination of those two, and it comes out about $12,000, that's about what a health maintenance organization is charging for an insurance policy today. You pay part of that, your employer pays part of that.
Right.
So that's about what we're paying today. The difference in a free market is that if you bought an additional policy, so you're looking at $8,000 additional policy premium that you would have to pay, and you have a 1% chance of ever achieving that, so you would pay a premium, about 1% of that total and add that to your premium. Now what you have is what they call a health status account, health status insurance. If you come down with a chronic condition, what you're calling, that would be an ongoing pre-existing condition, your insurance company would deposit in an account for you a lump sum, which would be several $100,000, that would cover the premiums to continue your insurance policy. So now what you're doing is you're paying a small annual premium, probably about $1,000 additional to your regular premium, but if you suddenly developed a chronic condition, your insurance would remain in effect and you would have a lump sum money that you could only use to pay the premiums on the insurance. If you wanted to change insurance companies, you could, the same way that you can transfer balances from one credit card to another. One insurance company pays off the other, puts the money in the fund, and you have your insurance continues even if you change jobs, change insurance companies. If you get better, all the better for the insurance company, because either when you die or when you no longer have the chronic condition, the money reverts back to the insurance company.
But doesn't that mean when you're, that in order for a plan like that to work, a person would actually have to purchase coverage or get health insurance coverage when they're young so that the company could afford to have this pot of money or this annuitized amount of money in place?
The motivation for the person to get it when they're young is that the premium is lower. If I'm now 58 years old and I want to get that insurance, I'm going to have to pay a much higher premium on it.
Yes.
Than there is. So what you're talking about is is transferring from the system we have now to the system we have, to that kind of a system. And yeah, in that place there's going to be a role for government because some people are not going to be able to afford that. But from a cost-benefit standpoint, it would be far cheaper and far more productive for the system if government were to put money in some accounts for people who have pre-existing conditions, let them go out and choose their own insurance.
Now let me ask you something that's a little divergent from your free market approach. I want to get your answer to this. Some people in the political sphere, even some people that are Republicans, have suggested that we excuse me, have suggested that we take a look at Medicare, and and with the understanding that there are a lot of inefficiencies within the Medicare system, that we perhaps look at lowering the cost, and I want you to answer what you think of this, lowering the cost of Medicare. Not lowering the cost, lowering the age of Medicare. Maybe down to 50, some people said 50, some people said 55, because typically it's that age group, it's the baby boomers that are the most expensive group to insure, for that 50-year-old
also
group
a big voting block.
up to 66 or 65 when they collect their Medicare. And the argument that's been made, and I think President Clinton made this argument, is that, number one, if we were to lower the age for Medicare eligibility, it would lower the cost per person in Medicare, so it would actually have a positive price impact on the cost of Medicare. Number two, it would help employers a lot, because baby boomer types, or people in that AARP age group, pre-retirement AARP age group, are actually the most expensive to insure. And by taking that off of the load of the companies, because today we have a employer-based healthcare system, that they would actually be able to significantly lower their cost of producing products and services. So the argument, again, that was made by President Clinton, I think also Senator Susan Collins from Maine, is that if you were to do those things, that Medicare could actually become more solvent because of the lower cost per person, and that business could actually do a better job as far as their financial stake, because you would be lowering the healthcare costs by businesses only insuring people that are younger and healthy. I'd like you to respond to that. I mean, on the face of it, that seems like a pretty reasonable approach to things.
Well, I'll respond to this without trying to regurgitate.
Please.
First off, let me frame it, and then I will specifically answer your question.
Okay.
But when you hear people talk like that, understand what they're talking about. They're talking about making the system more effective, and they're leaving out any conversation about doctors and any conversation about patients. And doctors ultimately are the ones who are going to provide this service. Not, Medicare doesn't provide any services. Medicare provides money. Doctors provide services. Okay. Let's look at Medicare, because your extension of Medicare is really the first step in what universal health care insurance is being billed at, which is Medicare for everybody. If Medicare works great for people who are at such and such an age group, let's do Medicare for everybody. Well, the reason Medicare works to whatever extent it does work is because it doesn't apply to anybody. Medicare rates right now that they're paying doctors are so incredibly low that you're seeing a lot of doctors who will not take new Medicare patients. They'll take their patients that age into Medicare and treat them, but they simply cannot make back cost of doing business, let alone doing profits. So what happens when you drop the cost of Medicare, that's everything that you said is exactly right. It's going to be great for the Medicare system, make it more solvent and everything, but the doctors aren't going to be able to treat those patients because there isn't enough money there to make back their cost. We're not talking about profit. We're not talking about buying a new Cadillac. We're not talking about green fees at Pebble Beach. We're talking about there isn't enough cost there for doctors to make back enough money to make back their costs. So the lower you get, the lower you make the age for Medicare, great for the system, but those people are not going to be able to get treatment where they want to get it. What you're doing is you're essentially passing the burden of the system on to the patient. So I might have to drive across town to find a doctor who's going to treat me instead of going to the doctor in my neighborhood because he won't treat Medicare patients. Well, you've passed the pain on to the patient, and that's ultimately the problem with any government-run system is in any healthcare system, any system, you have three things that a system can deliver. How many, of what kind, at what cost? In medicine, that translates into, what level of quality, at what cost, for how many people. And if you're and when you have a government-run system, you have to control costs somehow. We don't have unlimited resources for medicine. You have to control costs somehow. And you have to control costs by limiting access or by changing the definition of quality and reducing the quality. So, again, dropping the Medicare costs, good for the system, but it doesn't solve the problem for doctors, and it makes it more inconvenient for patients.
Okay, let me back off, just to back up to another issue in the whole healthcare debate that comes up. I believe that people in the medical profession can get payment from drug companies by offering certain types of help for their patients. In a true altruistic world, people, doctors would give what is best and wouldn't base their decisions on some commission that they might get from offering a certain product. And I brought up earlier in a previous discussion, one time I was offered as a prescription Nexium, which is more expensive than Prilosec, and basically the two drugs are pretty close to the same. And when I asked the doctor said, yeah, you can use Prilosec instead of my prescription of Nexium, even though my product is more expensive. And so I guess the other question, in a free market system, a doctor would be able to prescribe whatever medication they want to a patient. And usually a patient isn't going to have the medical knowledge or expertise to determine what type of drug would be best for their ailment. How do you deal with the situation in a free market system where maybe a doctor makes prescriptions to patients based on what they're getting back in return for commissions?
Yeah, well, first off, I think that whenever we're talking about medical care now, we want to get away from, we try to get away from economics and try to blame somebody for something. I mean, if you look at the broader base, and I will answer your question, but I want to set a framework here. If you look at the broader base of the whole debate over medicine, we're saying now, well, the reason it's so expensive is because doctors are prescribing all these services, so they get fee for service. And
right, exactly. That's what I said.
It's the doctor's fault. And it would be naive to say there aren't doctors out there who are in it for the money and are not in it for altruistic purposes. But the vast majority of doctors are like the vast majority of businessmen, like the vast majority of teachers. They're in it because they want to be in the business and they want to help. They want to help people. The answer. I agree to that. The answer to your question is, the problem is, let's establish transparency so that that doctors have to declare what they're doing. I mean, everybody in every business is going to have. There's going to be those conflicts. But let's assume that. Take your assumption, the underlying assumption of what you're saying, that doctors are all greedy bastards that want to take and are just out there to get the money out of the people. So what are we establishing for a system? We're establishing a system where doctors are going to be rewarded if they reduce their costs. Well, if they're going to be rewarded for the reduce their costs, what's their motivation? Their motivation is not to give you Prilosec, but not to give you anything, because if they reduce their costs, they get a kickback from the government. So putting more government is not the solution. The solution in a free market is demand transparency of what doctors are getting, and the markets will take care of that. They will weed out the people who are so blatantly, doing that kind of thing. You're also going to see, if you look at a free market system, you're also going to see a lot of consumer advocacy groups grow up that aren't there now. If you look out there now, you have your consumer reports, and you have all these people doing reports on things that are free market oriented, automobiles and sales. You're going to end up with this in the place. So I guess my short answer to your question is, all the regulation in the world isn't going to stop the crook or the guy who doesn't have the ethics. What you need to do is establish a broader base of transparency so you know what doctors are doing. You have to establish specific rules. I'm not against that kind of regulation that says, that protects patients from force and fraud. The kind of regulation that I'm against is regulation that tells an insurance company what they have to cover, tells a doctor what they must charge. Those are bad regulations.
Okay. Within the few or couple minutes that we have left, and I want to go to another area that has been hit, with the health care. Right now, bankruptcy, the cause of bankruptcy for an American person or family, highest reason, health care problems. And how does your system that you're talking about, how is that going to help? Are we going to see more and more people without coverage because of they can't afford the free market process that you're talking about? So, I mean, is the bankruptcy issue going to go dissipate, or is it going to remain where it is?
Let me
is that good? Good. Yeah.
Let me address your bankruptcy question. The exact statistic is 50% of all personal bankruptcies are the result of medical costs. But in that same study that number comes from, the raw number of personal bankruptcies is not high, so that personal bankruptcies affect less than 1% of the people in the United States. So that's the extent of the problem. 50% is more scary than less than 1%. Now, how would you handle that situation? What you need to do, if you're in a free market system, people who can afford it will have their insurance, and you'll isolate a group of people who can't afford that insurance. Then I think it's perfectly reasonable in a transition period for government to step in and take care of those people who can't afford the insurance.
All right.
That is a much better, and take care of them, not by sticking them into a program, but by saying, here's your voucher, now you go out and participate in the market. That is much better than screwing up the system for everybody to take care of a very small percentage of the people.
Thank you. We only have a couple minutes left, so Craig, what I'd like to have you do, you explained a little earlier about what, about the Free Market Institute. What can you tell people if they want to get a hold of you, or if they want to get a hold of the Free Market Institute? And I also want to say that you have a column in the St. Paul paper that's very entertaining and also very enlightening. So if you could tell the audience about that a little bit.
I appreciate that. My column is, I do write a column for the St. Paul Pioneer Press, and I'm the token conservative libertarian voice there, so everybody who wants to come in and yell at me, they can go ahead. The Minnesota Free Market Institute, I think we're all a web-based company now. The best way to get a hold of us is you can use one of two web addresses. Our website is www.mnfreemarketinstitute.org, or the shorthand is mnfmi.org. And I should know our phone number, and I don't, so I'll give out my personal number, which is 612-309-1492, and that number will reach me at the office. So.
Okay, great. Well, Craig, I really appreciate it.
Tom, I enjoyed it, and I'd like to have more time, but...
Yeah, enlightening conversation. Have you back sometime, but I appreciate this very much. And this is a wonderful discussion we had. And once again, this is the Metro North Chamber of Commerce taking care of business. We're on Tuesday, Wednesdays, and Thursday nights at 7 o'clock. Thank you very much. Bye-bye.